I thought we'd talk about strokes. A stroke occurs when blood flow to a certain portion of your brain reduces, causing cells to die, resulting in neurological impairments. Strokes are categorized into two classes, that being ischemic and hemorrhagic. Around 80% of ischemic strokes are due to thrombi. Others can be caused by emboli or hyperperfusion due to circulatory collapse. So in total, ischemic strokes account for about 87% of all strokes, according to Wikipedia, with the other 13% being caused by hemorrhagic strokes. Now this can be subarachnoid or cerebral hemorrhages. Both can be caused by trauma, but in medical strokes, things like aneurysms, uncontrolled hypertension, anticoagulation, these sorts of things are the culprits. Now there are several pre-hospital stroke assessment tools, things like Rosier, FAST assessment, and RACE. The most popular of these being the FAST assessment, and we're going to talk about ACT-FAST. Now the ACT-FAST stroke assessment tool adds a layer of complexity on top of the FAST assessment, and it is designed to recognize ischemic strokes, specifically large vessel occlusions. Recognizing this kind of stroke pre-hospital informs your transport destination. That's because with an ischemic stroke, depending on time of onset, you're going to want a hospital which has thrombolytic and endovascular clot retrieval facilities. Now, the cool thing about the ACT-FAST algorithm is that by using it, paramedics have actually demonstrated an 85.7% sensitivity, that's identifying a true positive, and a 93.5% specificity, that's identifying a true negative, adding up to a total of 80% accuracy of recognition of large vessel occlusions pre-hospitally. Okay, so here we've got a patient who's got a suspected stroke. They've called in for stroke. We can check for obvious things such as facial droop and gross motor deficits down one side, causing the patient to slump over to one side. But what are we going to do if the stroke and signs of stroke aren't standing out as obviously? So this is where the ACT-FAST tool comes in. Okay, so step one, first of all, we get the patient to situate their arms at 45 degrees up from horizontal. We get them to close their eyes and over the course of 10 seconds, actively try and maintain their arms in a equal fashion. Now, over this course of 10 seconds, if one arm starts to droop down like this, all the way down to, let's say, the arm of the chair or the stretcher, then that's a positive sign for step one. So in this case, we stand on the side of the patient which has the deficits, which is left side, and we observe that the patient has an obvious gaze preference to the other side other than the weakness. Now, if that's the case, then that's a positive sign. Now, if that obvious gaze preference isn't occurring in this patient, then we can tap the patient twice on the shoulder and call their name. Lara. If there's a delayed response, then that's a positive sign as well. If we get this far with step three, then we've got a positive sign for large vessel occlusion. We want to assess when these symptoms first start. We want to make sure that we are within the approved window where we can have thrombolysis and clot retrieval. And we want to rule out other stroke mimics. So guys, that's the ACT-FAST algorithm. It's really amazing when you see these subtle signs in real life, like in the field. Let us know in a comment down below if you use different tools, if you have a preference for other tools, and if you think there's any weaknesses with the ACT-FAST algorithm.